We have some statistics I want to share with our viewers, and it's from the Centers for Disease Control on cigarettes and death. 1 out of every 5 deaths is cigarette-related each year. That is more deaths than AIDS, alcohol, car accidents, illegal drugs, murder, and suicides combined. We also have a breakdown of smoking deaths by sex. Men account for almost 280,000 deaths, while women are slightly over at 200,000, both very high numbers. And then one last statistic here, men who smoke are at an increased risk for dying from bronchitis, emphysema, lung cancer, and coronary heart disease. I do want to share with our viewers a 3D image of a lung, and Doctor, you walk us through in terms of what we're looking at.
Sure. Well, these are pictures of what the lung looks like. So this is a dark lung. Lungs are supposed to be pink, like a sponge. And people who smoked have a lot of carbon in the lung, and it gets black like that. So that's the outside appearance if you open the chest and look inside, if you've been a smoker. And this is someone with emphysema, which is a lung with holes in it. You see these little gaps up here. Most of the smoke goes to the upper lobes, so most of the damage in emphysema is in the upper lobes, and these little distended cavities are what you see in emphysema. And that's damage and a bad thing, obviously. And this looks at the structures within the lungs, the airways, the blood vessels, and you can see this is nice and red, which exaggerates the bronchitis that occurs from the irritant effects of smoking.
Okay. And
it shows this yellow stuff, which is mucus, which is the increased amount of mucus that the glands produce that chokes up people with chronic bronchitis. And it shows thickening and scarring around the edge of the lung, which happens eventually because of inflammation in the lung and oxidation of the lung tissue, which is what causes the lung damage that lowers oxygen and creates difficulty breathing. So those are the basic bad things that happen from smoking.